Hello and welcome back to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Thursday, March 20th at 10 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today we are joined via video conference by Rachel Roubein of the Washington Post.
Hi.
Sarah Karlin-Smith of the Pink Sheet.
Hi, everybody.
And Jessie Hellmann of CQ Roll Call.
Hello.
No interview today, but as usual, way more news than we can get to, so let us jump right in. In case you missed it, there's a bonus podcast episode in your feed. After last week's Senate Finance Committee confirmation hearing for Dr. Mehmet Oz to head the Centers for Medicare and Medicaid Services, my KFF Health News colleagues Stephanie Armour and Rashana Pradhan and I summarized the hearing and caught up on all the HHS nomination actions. It will be the episode in your feed right before this one. So, even without Senate-confirmed heads at, checks notes, all of the major agencies at HHS, the department does continue to make news. First, Robert F. Kennedy Jr., the new HHS secretary, speaks. Last week it was measles. This week it was bird flu, which he says should be allowed to spread unchecked in chicken flocks to see which birds are resistant or immune. This feels kind of like what some people recommended during COVID. Sarah, is there any science to suggest this might be a good idea?
No, it seems like the science actually suggests the opposite because doctors and veterinary specialists are saying basically every time you let the infection continue to infect birds, you're giving the virus more and more chances to mutate, which can lead to more problems down the road. The other thing is they were talking about like the way we raise animals and for like food these days, there isn't going to be a lot of genetic variation for the chickens. So it's not like you're going to be able to find a huge subset of them that are going to survive bird flu. And then the other thing I thought is really interesting is just it doesn't seem economically to make the most sense either as well, both for the individual farmers, but then for U.S. industry as a whole, because it seems like other countries will be particularly unhappy with us and even maybe put prohibitions on trading with us or those products due to kind of the spread of bird flu.
Yeah, it was eyebrow-raising, let us say. Well, HHS this week also announced its first big policy effort called Operation Stork Speed. It will press infant formula makers for more complete lists of ingredients, increase testing for heavy metals in formula, make it easier to import formula from other countries, and order more research into the health outcomes of feeding infant formula. This feels like maybe one of those things that's not totally controversial, except for the part that the FDA workers who've been monitoring the infant formula shortage were part of the big DOGE layoffs.
I talked to some experts about this idea, and like you said, they thought it kind of sounded good, but they basically needed more details, like what does it mean? Who's going to review these ingredients? To your point, some people did say that the agency would need to staff up, and there was like a neonatologist who is heading up infant formula that was hired after the 2022 shortage, who was part of the pro-berry worker terminations. However, when the FDA rescinded the terminations of some workers, so that doctor has been hired back. So I think that's worth noting.
Yes. This is also, I guess, where we get to note that Callie Means, one of RFK Jr.'s, I guess, brain trust in the MAHA movement, has been hired as, I guess, in an Elon Musk-like position in the White House as an advisor. But this is certainly an area where he would expect to weigh in.
Yeah, I saw he's really excited about this on Twitter or X. There's just been concerns in the MAHA movement, Make America Healthy Again, about the ingredients that are in baby formula. And the only thing is, I saw that he also retweeted somebody who said that breast is best. And I'm just hoping that we're not going back down that road again, because I feel like public health did a lot of work in kind of pushing the message that formula and breast milk is good for the child. And so that's just kind of another angle that I've been thinking about on this.
Yes, I think this is one of those things that everybody agrees we should look at and has the potential to get really controversial at some point. While we are on the subject of the federal workforce and layoffs, federal judges and DOGE continue to play cat and mouse with lots of real people's lives and careers at stake. Various judges have ordered the reinstatement, as you mentioned, Rachel, of probationary and other workers, although in many cases workers have been reinstated to an administrative leave status, meaning they get put back on the payroll and they get their benefits back, but they still can't do their jobs. At least one judge has said that does not satisfy his order. And this is all changing so fast, it's basically impossible to keep up. But is it fair to say that it's not a very stable time to be a federal worker?
That's probably the nicest possible way to put it. I mean, when you talk to federal workers, everybody seems stressed and just unsure of their status. And if they do have a job, it's often, from their perspective, tougher to do their job lately. And then they're just not sure how stable it is. And many people are considering what options they have outside the federal government at this point.
So for those lucky federal workers who do still have jobs, the Trump administration has also ordered everyone back to offices, even if those offices aren't equipped to accommodate them. FDA headquarters here in Maryland's kind of been the poster child for this week.
Yeah, FDA is an interesting one because well before COVID normalized working from home and transitioned a lot of people to working from home, FDA's headquarters couldn't accommodate a lot of the new growth in the agency over the years, like the tobacco part of the FDA. So it was typical that people at least worked part of their work week at home. And FDA really found once COVID gave them additional work from home flexibilities, they were able to recruit staff they really, really needed with specialized degrees and training who don't live near here. And it actually turned out to be quite a benefit from them. And now they are saying everybody needs to be, in an office 5 days a week. And you have people basically cramped into conference rooms. There's not enough parking. People are trying to review technical scientific data and, you kind of can't hear yourself think, or you're a lawyer. I heard of a situation where people are basically being told, well, if you need to do sort of a private phone call because of the confidentiality around what you're doing, go take the call in your car. So I think in addition to all of the concerns people have around the stability of their jobs, there's now this element of, on a personal level, I think for many of them, it's just made their lives more challenging. And then they just feel like they're not actually able to have the same level of efficiency at their work as they normally would.
And for those who don't know, the FDA campus is on a former military installation in the Maryland suburbs. It's not really near any public transportation. So you pretty much have to drive to get there. And I think that, the parking lots are not that big because, as you pointed out, Sarah, the workforce is now bigger than the headquarters was created to accommodate it. And we're seeing this across the government. I mean, this week it happened to be FDA. You have to ask the question, is this really just an effort to make the government not work, to make federal workers, if they can't fire them, to make them quit?
I definitely think that's part of the underlying goal. If you see some of the stuff that Elon Musk says about the federal workforce, it's very dismissive, doesn't seem to have a lot of respect for the civil servants, and they've been running into a lot of pushback from federal judges over many lawsuits targeting these terminations. And so I think just making conditions as frustrating as possible for some of these workers is until they quit is definitely part of the strategy.
And I think this is overlaid with the additional buyout offers, the additional early retirement offers. There's also the reduction in force plans that federal workers have been unnerved about, bracing for future layoffs. So it's very clear that they want to shrink the size of the federal workforce.
Yeah, we've seen a lot of these people. I've seen interviews with them who are being reinstated, but they're still worried that now they're going to be riffed. They're back on the payroll. They're off the payroll. There's nothing. This does not feel like a very efficient way to run the federal government.
Right. I think that's what a lot of people are talking about is, again, going back to offices for many of these people is not leading to productivity. I talked to one person who said, I'm just leaving my laptop at the office now. I'm not going to take it home and do the extra hours of work that they might have normally gotten from me. And that includes, losing time to commute. FDA is paying for parking garage spaces in downtown Silver Spring near the metro so that they can then shuttle people to, the FDA headquarters. I've taken buses from that metro to FDA headquarters. In traffic, that's a 30-minute drive. They're spending money on things that, again, I think are not going to, in the long run, create any government efficiency. And in fact, I've been talking to people who are worried it's going to do the opposite, that drug review, device review, medical product review times and things like that are going to slow. We talked about food safety. I think the New York Times had a really good story this week about concerns about, losing the people we need to make sure that baby formula is actually safe. So there's a lot of contradictions in the messaging of what they're trying to accomplish and how the actions actually are playing out.
Well, and finally, I'm going to lay one more layer on this. There's the question of whether you can even put the toothpaste back in the tube if you wanted to. After weeks of back and forth, a federal judge ruled on Tuesday that the dissolution of USAID was illegal and probably unconstitutional, and ordered email and computer access restored for the remaining workers while blocking further cuts. But with nearly everybody fired, called back from overseas, and contracts canceled, USAID couldn't possibly come close to doing what it did before DOGE basically took it apart, right?
Right. You hear stories of if someone already takes a new job, they're lucky enough to find a new job, why are they going to come back? Again, even if you're brought back, my expectation is a lot of people who have been brought back are probably looking for new jobs regardless, because you don't have that stability. And I think the USAID thing is interesting too, because again, you have people that were working in all corners of the world, and you have partnerships with other countries and contractors that have to be able to trust you moving forward. And the question is, do those countries and those organizations want to continue working with the U.S. if they can't have that sort of trust? And as people said, the U.S. government was sort of known as they could pay contractors less because they always paid you, kind of thing. And when you take that away, that creates a lot of problems for negotiating deals to work with them moving forward.
And I think that's true for federal workers, too. There's always been the idea that, you probably could earn more in the private sector than you can working for the federal government, but it's always been a pretty stable job. And I think right now it's anything but. So comes the question of, are we deterring people from wanting to work for the federal government? Eventually one would assume there's still going to be a federal government to work for, and there may not be anybody who wants to do it.
Yeah, you saw various hiring authorities given to try and recruit scientists and other researchers who make a lot more in the public health sector. And, some of those were a part of the probationary workforce because they had been hired recently under sort of those authorities.
Yeah, and now this is all sort of coming apart. Well, meanwhile, the cuts are continuing even faster than federal judges can rule against them. Last week, the administration said it would reduce the number of HHS regional offices from 10 to 4. Considering these are where the department's major fraud fighting efforts take place, that doesn't seem a very effective way of going after fraud and abuse in programs like Medicare and Medicaid. Those regional offices are also where lots of beneficiary protections come from, like inspections of nursing homes and Head Start facilities. How does this serve RFK Jr.'s Make America Healthy Again agenda?
I think it's not clear that it does, right? You're talking about, again, the Department of Government Efficiency has focused on efficiency, cost savings, and Medicare and Medicaid does a pretty good job of fighting fraud and making HHS OIG, all those organizations, they collect a lot of money back. So when you lose people...
And of course, the Inspector General has also been laid off in all of this.
It's not clear to me. I think one of the things with that whole reorganization of their chief counsel is people are suggesting, again, this is sort of a power move of HHS wanting to get a little bit more control of the legal operations at the lower agencies, whether it's NIH or FDA and so forth. But it's sort of reducing headcount without really thinking about what people's roles actually were and what you lose when you let them go.
Well, the Trump administration is also continuing to cut grants and contracts that seem like they'd be the kind of things that directly relate to Make America Healthy Again. Jessie, you've chosen one of those as your extra credit this week. Tell us about it.
Yeah, so my story is from STAT, and it's about a nationwide study that tracked patients with prediabetes and diabetes. And it was housed at Columbia University, which, as we know, has been the subject of some criticism from the Trump administration. They had lost about $400 million in grants because the administration didn't like Columbia's response to some of the protests that were on campus last year. But that has an effect on some research that really doesn't have much to do with that, including a study that looked at diabetes over a really long period of time. So it was able to, over like decades, result in 200 publications about pre-diabetes and diabetes, and kind of led to some of the knowledge that we have now about the interventions for that. And the latest stage was going to focus on dementia and cognitive impairment, since some of the people that they've been following for years are now in their older ages, and now they have to put a stop to that. They don't even have funding to analyze blood samples that they've done and the brain scans that they've collected. So it's just another example of how what's being done at the administration level is kind of contradicting some of the goals that they say that they have.
Yeah, and I mean, it's important to remember that Columbia's funding is being cut not because they deemed this particular project to be not helpful, but because they are, as you said, angry at Columbia for not cracking down more on pro-Palestinian protesters after October 7th. Well, meanwhile, people are bracing for still more cuts. The Wall Street Journal is reporting the administration plans to cut domestic AIDS HIV programming on top of the cuts to the international PEPFAR program that was hammered as part of the USAID cancellation. Is fighting AIDS and HIV just way too George W. Bush for this administration?
It's interesting because President Trump unveiled the Ending the HIV Epidemic initiative in his first term, and the goal was to end the epidemic in the United States. And so if they're talking about reducing some of that funding, or I know there are reports that maybe they would move the funding from CDC to HRSA, it's very unclear at this point, then it raises questions about whether it would undermine that effort. And there's already actions that the Trump administration has done to undermine the initiative, like the attacks on trans people. They've canceled grants to researchers studying HIV. They have done a whole host of things. That they've canceled funding to HIV services organizations because they have like trans in their programming or on their websites. So it's already kind of caused a lot of anxiety in this community. And yeah, it's just a total turnaround from the first administration.
I know the Whitman Walker Clinic here in Washington, which has long been one of the premier AIDS HIV clinics, had just huge layoffs. I mean, this is already happening. And, you know, as you point out, this was something that President Trump in his first term vowed to end AIDS HIV in the U.S. So this is not, one would think, how one would go about that. Well, it's not just the administration that's working to constrict rights and services. A group of 17 states led by Texas, of course, are suing to have Biden-era regulations concerning discrimination against trans people struck down, except as part of that suit, the states are asking that the entirety of Section 504 of the Rehabilitation Act be declared unconstitutional. Now, you may never have heard of Section 504, but it is a very big deal. It was the forerunner of the Americans with Disabilities Act, and it prevents discrimination on the basis of disability in all federally funded activities. It is literally a lifeline for millions of disabled people that enables them to live in the community rather than in institutions. Are we looking at an actual attempt to roll back basically all civil rights as part of this war on woke and DEI and trans people?
The story is interesting because it seems like some of the attorneys general are saying that's not our intent. But if you look at the court filings, it definitely seems like it is. And yeah, like you said, this is something that would just have a tremendous impact. And Medicaid coverage of home and community-based services is one of those things that states are constantly struggling to pay for. You're just continuing to see more and more people need these services. Some states have waiting lists. So
I think most states have waiting lists.
It's something you have to really question what the intent is here. I mean, even if people are saying this isn't our intent, it's pretty black and white on paper in the court records. So
yeah, just to be clear, I mean, this was a Biden administration regulation updating the rules for Section 504 that included reference to trans people. But in the process of trying to get that struck down, the court filings do, as you say, call for the entirety of Section 504 to be declared unconstitutional. This is obviously one of those court cases that's still before the district court, so it's a long way to go. But the entire disability community, certainly it has their attention. Well, we haven't had any big abortion news the past couple of weeks, but that is changing. In Texas, a midwife and her associate have become the first people arrested under the state's 2022 abortion ban. The details of the case are still pretty fuzzy, but if convicted, the midwife, who reportedly worked as an OBGYN doctor in her native Peru and served a mostly Spanish-speaking clientele, could be sentenced to up to 20 years in prison. So obviously be watching that one. Meanwhile, here in Washington, Hillary Perkins, a career lawyer chosen by FDA Commissioner nominee Marty McCary to serve as the agency's general counsel, resigned less than 2 days into her new position after complaints from Missouri Senator Josh Hawley that she defended the Biden administration's position on the abortion pill mifepristone. Now, Hillary Perkins is no liberal trying to hide out in the bureaucracy. She's a self-described pro-life Christian conservative hired in the first Trump administration, but she was apparently forced out for the high crime of doing her job as a career lawyer. Is this administration really going to try to evict anyone who ever supported a Biden position? Will that leave anybody left?
I think what's notable is like Senator Josh Hawley here, who expressed concerns, and I'd heard express concerns to the White House. And the post on X from the FDA came an hour before the hearing. There were concerns that he was not going to make it out of committee. And
before the Marty McCary hearing.
Yes, sorry, before the vote in the Help Committee on Marty McCary. And Hawley said because of that, he would vote to support him. What was interesting is 2 Democrats actually ended up supporting him, so he could have kind of passed without Hawley's vote. But I think in general, it poses a test for Marty McCary when he's in FDA commissioner, and how and whether he's going to get his people in and how he'll respond to different pressure points in Congress and with HHS and with the White House.
And of course, Hawley's not a disinterested bystander here, right?
So his wife was one of the key attorneys in the recent big Supreme Court case that was sort of pushed down to the lower courts for lack of standing, but she was trying to essentially get tighter controls on the abortion pill mifepristone. But it seems like almost maybe Hawley sort of jumped too soon before doing all of his research or fully understanding the role of people at justice, because even before this whole sort of controversy erupted, I had talked to people the day before about this and asked them, like, should we read into this, her being involved in this? And everybody I talked to, including, I think, a lot of people that have different views than Perkins does, on the case, they were saying, like, she was in a role as a career attorney. You do what your boss, what the administration wants. I mean, if you really, really had a big moral problem with that, you can quit your job. But, it's perfectly normal for an attorney in that kind of position to defend a client's interests and then have another client and maybe have to defend them wrongly. So it seems like if they had just maybe even picked up the phone and had a conversation with her, the whole kind of crisis could have been averted. And she was on CNN yesterday sort of trying to lead her case and again emphasize her positions, because perhaps she's worried about her future career prospects, I guess, over this debacle.
Yeah, now she's going to be blackballed by both sides for having done her job, basically. Anyway, all right, well, one big Biden initiative that looks like it will continue is the Medicare drug price negotiation program. And we think we know this because CMS announced last week that the makers of all of the 15 drugs selected for the second round of negotiations have agreed to, negotiate. Sarah, this is news, right? Because we were wondering whether this was really going to go forward.
Yeah, they've made some other signals since taking over that they were going to keep going with this, including last week at his confirmation hearing, Dr. Oz for CMS also indicated he seemed like he would kind of uphold that law and they were looking for ways to lower drug costs. So I think what people are going to be watching for is whether they yield around the edges in terms of tweaks the industry wants to the law, or is there something about the prices they actually negotiate that signal they're, not really trying to get them as low as they can go. But this seems to be one populist issue for Trump that he wants to keep leading into and kind of keep the same, consistency, I think, from his first administration, where he always kind of took a pretty hard line on the drug industry and drug pricing.
And I know Ozempic is on that list of 15 drugs, but the administration hasn't said yet. I mean, I assume that's Ozempic for its original purpose in treating diabetes. This administration hasn't said yet whether they'll continue the Biden declaration that these drugs could be available for people for weight loss, right?
Correct. And I think that's going to be more complicated because that's so costly. So negotiating the price of drugs saves money. So yes, like basically because Ozempic and Wegovy are the same drug, that price should be available regardless of the indication. But I'm more skeptical that they continue that policy because of the cost. And also just because, again, HHS Secretary Robert F. Kennedy seems to be particularly skeptical of the drugs, or at least using that as a first line of defense, widespread use, reliance on that. He tends to, in general, I think, support other ways of medical, I guess, treatment or health, treatments before
eating
turning to
better and
pharmaceuticals.
Exercising.
Correct. Right. So I think that's going to be a hard sell for them because it's just so costly.
We will see. All right. That is as much news as we have time for this week. Now it is time for our extra credit segment. That's where we each recognize a story we read this week we think you should read too. Don't worry if you miss it. We will put the links in our show notes on your phone or other mobile device. Jessie, you've done yours already this week. Rachel, why don't you go next?
My extra credit, the headline is Her Research Grant Mentioned Hesitancy, Now Her Funding Is Gone, in the Washington Post by my colleague Caroline Y. Johnson. And I thought the story was particularly interesting because it really dove into sort of the personal level. You sort of hear about all these cuts from a high level, but you don't always really kind of know what it means and how it came about. So the backstory is the National Institutes of Health terminated dozens of research grants that focused on why some people are hesitant to accept vaccines. And Carolyn profiled one researcher, Nisa Acharya, but there was a twist, and the twist was she doesn't actually study how to combat vaccine hesitancy or ways to increase vaccine uptake. Instead, she studies how well the shingles vaccine works to prevent the infection, with a focus on whether the shot also prevents the virus from affecting people's eyes. But in the summary of her project, she had used the word hesitancy once and used the word uptake once. And so this kind of highlights the sweeping approach to kind of halting some of these vaccine hesitancy research grants.
Yeah, that was like the DOD, getting rid of the picture of the Enola Gay, the plane that dropped the atomic bomb because it had the word gay in it. This is sort of the downside, I guess, of using AI for these sorts of things. Sarah.
I took a look at a KFF story by Arthur Allen. Scientists say NIH officials told them to scrub mRNA references on grants. And it's about NIH officials urging people to, remove any reference to mRNA vaccine technology from their grants. And the story indicates it's not yet clear if that is going to translate to defunding of such research, but the implications are quite vast. I think most people probably remember the mRNA vaccine technology is really what helped many of us, survive the COVID pandemic and is credited with saving millions of lives. But the technology promise seems vast even beyond infectious diseases, and there's a lot of hope for it in cancer. And so this has a lot of people worried. It's not particularly surprising, I guess, because, again, the sort of anti-vaccine movement, which Kennedy has been kind of a leader of, has been particularly skeptical of the mRNA technology. But it is problematic, I think, for research. And, we spent a lot of time on this call talking about sort of the decimation of the federal workforce that may happen here. And I think this story and some of the other things we talked about today kind of also show how we may just disseminate our entire scientific research infrastructure and workforce in the U.S. outside of just the federal government, because so much of it is funded by NIH, and the decisions they are making are going to make it impossible for a lot of scientists to do their job.
Yeah, we're also seeing scientists going to other countries, but that's for another time. Well, my extra credit this week, probably along the same lines, also from the Washington Post. It's part of a series called Who is Government? This particular piece is by best-selling author Michael Lewis, and it's a sprawling, and I mean sprawling, story of how a mid-level FDA employee who wanted to help find new treatments for rare diseases ended up not only figuring out a cure for a child who was dying of of a rare brain amoeba, but managed to obtain the drug for the family in time to save her. It's a really good piece, and it's a really excellent series that tells the stories of mostly faceless bureaucrats who actually are working to try to make the country a better place. Okay, that's this week's show. As always, if you enjoy the podcast, you could subscribe wherever you get your podcast. We'd appreciate it if you left us a review. That helps other people find us too. Thanks, as always, to our producer, Francis Ying, and our editor, Emery Hudeman. As always, you can email us your comments or questions. We're at whatthehealth, all one word, at kff.org. Or you can still find me at X, at Rovner, and at Blue Sky, at Julie Rovner. Where are you guys these days, Sarah?
A little bit everywhere. X, Blue Sky, LinkedIn, at Sarah Karlin or at Sarah Karlin-Smith.
Jessie?
I'm at Jessie Hellmann on X and Blue Sky, and I'm also on LinkedIn more these days.
Great. Rachel?
Rachel Roubein at Blue Sky, Rachel_Roubein on X, and also on LinkedIn.
We will be back in your feed next week. Until then, be healthy.